McKee?
very much misrepresents what's happening. We've got record funding of 21 billion going into the health service. We're further advanced in terms of social care and health integration in Scotland. The rest of the UK is catching up with us. We've got the best performing A&E department in Scotland compared to the rest of the UK, and we're working very hard on waiting lists, which I think in the last data were lower in Scotland than in the rest of the UK. So we've absolutely got a focus on more funding going in. That funding has gone in, but we've also got a very clear focus on the reform agenda around about the health service. I'm working very hard with the Cabinet Secretary for Health and with other ministers to make sure we're delivering on that reform agenda. I had meetings this morning with local authorities and NHS boards to see how they can work more closely together to help be more efficient on the ground, and we're working very hard on waiting lists.
Well, that all sounds great, except the Spending Watchdog Audit Scotland has said that the NHS in Scotland is unsustainable in its present state. Local authorities want more cash and autonomy, and the unions say education is threatened by a lack of teachers. So have you actually made the wrong choice in terms of your priority?
No, I don't think so. We've got, I think, about 20% more teachers per head of population in Scotland than there is across the rest of the UK, and they're paid significantly more. Starter teacher in Scotland gets paid about £6,000 more.
So why are the unions saying education in Scotland is threatened by a lack of teachers if they're so well paid? And
absolutely, those are the facts, right? The union can speak for themselves, and of course they're always going to argue for more money and more staff. But as I say, there's 20% more teachers per head of population in Scotland than there is in the rest of the UK.
Right,
so and if you look at on doctors and nurses, it's similar numbers. They're better paid in Scotland, nurses significantly so, and police officers. All of those public sector cohorts, frontline workers, there's around 20% more of them in Scotland.
All right, let me just get at some reaction.
So we've got our priorities right. We're focused on what's important.
Well,
delivery of the people of
Scotland.
Child poverty,
they're your priorities. The public will judge whether they're the right ones or not.